Your insurance company doesn't just collect your premiums. It also owns your doctor's practice. It owns the pharmacy that fills your prescriptions. And it owns the hospital network where your surgeon operates. One company controls all four sides of every healthcare decision in your life. UnitedHealth Group, $371 billion in revenue last year, $22 billion in profit. And here's what they do not want you to understand. When the company deciding whether your treatment is approved is the same company that profits from denying it, that is not a conflict of interest. That is the business model. I'm going to show you exactly how this monopoly was built, what it costs you every single year, and why it is completely legal. 52 million Americans are insured by UnitedHealthcare right now. That is 1 in 6 people in this country. And the majority of them have no idea that the same company processing their claims also employs the doctor who wrote the referral, also manages the pharmacy filling their prescriptions, also built the AI system deciding whether that prescription gets approved. According to an investigation by ProPublica and The Guardian in 2023, UnitedHealth Group's claims algorithm called NH Predict was denying claims at a rate of 9 out of 10, not 1 in 10, 9 in 10, and it was doing it automatically, without a single human ever reviewing the patient's file. If you have health insurance right now through your employer, through the marketplace, or through Medicare Advantage, what I'm about to show you directly affects you. And in a few minutes, I'm going to show you a specific federal law that was written exactly because of what this company is doing, a law most people have never used, because UnitedHealth Group is counting on that. Let me show you how this monopoly was built, because it did not happen overnight, and it did not happen by accident. UnitedHealth Group is not just an insurance company. It is a holding company with 2 divisions. The first is UnitedHealthcare. That is the insurer. That is the entity collecting your premiums every month. The second is a company called Optum, and Optum is where this gets alarming. Optum has 3 arms. OptumRx is one of the 3 largest pharmacy benefit managers in the country. A pharmacy benefit manager is the middleman that decides which drugs your insurance covers and at what price. UnitedHealthcare decides whether your procedure is covered. OptumRx decides whether your prescription is covered. Both decisions. Same parent company. OptumHealth employs approximately 90,000 physicians, nurses, and care professionals directly. These are doctors working inside a company owned by your insurer. When your primary care doctor works for Optum and your insurer is UnitedHealthcare, and both are owned by UnitedHealth Group, your doctor's employer and your insurance company are the same entity. Then there is OptumInsight. OptumInsight builds the algorithms that process claims. It also sells data analysis services to other insurance companies. UnitedHealth Group profits from the claims of its own patients and from analyzing the claims of patients at competing insurers. So when you file a claim with UnitedHealthcare, here is what actually happens. The claim enters a system built by OptumInsight. It is reviewed automatically by an algorithm trained on data from hundreds of millions of patient files. If your referral came from an OptumHealth physician, that data point is weighed. If your prescription is processed by OptumRx, that data point is weighed. The decision approve or deny is made in seconds by a company that profits from the denial. In 2023, a Senate investigation found that UnitedHealthcare was denying prior authorization requests at a rate more than double the industry average. Double, that is not a performance issue. That is a system working exactly as designed. And there is a specific phrase, 4 words that you can use after any denial that triggers a federal process your insurance company cannot ignore. I will give you that exact phrase before this video ends. I want to tell you about Linda. Linda is 61 years old. She spent 23 years as a school administrator in Indianapolis. She has been on her husband's union health plan, UnitedHealthcare, for 18 years. Last March, Linda's orthopedic surgeon recommended a total knee replacement. Her surgeon submitted the prior authorization request on a Tuesday. UnitedHealthcare denied it on Thursday. The denial letter said 4 words: not medically necessary. Linda's surgeon appealed. He submitted an additional 47 pages of documentation, x-rays, functional assessments, treatment history going back 11 years. UnitedHealthcare denied it again. The second denial letter said the same 4 words: not medically necessary. Linda did not know she had a third option. She had never heard of the federal external review process. She had never been told it existed. Her insurance card did not mention it. Her HR department did not explain it. She paid for the surgery out of pocket, $14,200. She took it from her retirement savings. Linda's case is not unusual. The American Medical Association surveys physicians every year on prior authorization. In their 2024 survey, 93% of physicians reported that prior authorization caused a delay in care for their patients. 30% reported that prior authorization led to a serious adverse event. Not an inconvenience. An adverse event? That is 1 in 3 physicians in America describing a patient who was harmed not by a disease, but by a paperwork process owned by a $300 billion company. Here is what makes this worse. UnitedHealth Group is a publicly traded company. Every quarter, its executives report to investors on financial performance. The metric investors watch is called the medical loss ratio. The medical loss ratio is the percentage of premium revenue the company pays out in claims. A lower medical loss ratio means less paid out in claims. A lower medical loss ratio is good for the stock price. A higher medical loss ratio means more paid out in claims. A higher medical loss ratio is bad for the stock price. So when UnitedHealth Group denies a claim, that is not a claims processing decision. That is a financial performance decision. The company has a documented, publicly reported financial incentive updated every 90 days to deny as many claims as possible. And the tool they built to do it is NH Predict. ProPublica and The Guardian found that NH Predict makes denial decisions based on average recovery times for a given diagnosis, not based on any individual patient's medical file. If the average hip replacement patient recovers in 14 days and your doctor says you need 20 NH Predict flags, that is an outlier. Not because your doctor is wrong, because the average says otherwise. Your medical history, your doctor's judgment, your actual condition, none of it is read by an algorithm built to minimize the medical loss ratio. Stay with me, because what I am about to show you next is the part they have worked very hard to keep quiet. In 2023, the Senate Permanent Subcommittee on Investigations published a report specifically on UnitedHealthcare and prior authorization. The report found that UnitedHealthcare denied prior authorization requests at a rate of 22%. The industry average at the time was 9%. The report also found that when patients bothered to appeal those denials, UnitedHealthcare reversed its own decision more than 70% of the time. 70%. Let me be precise about what that means. The majority of patients who received a denial from UnitedHealthcare and appealed at UnitedHealthcare admitted it was wrong. And the patients who accepted the denial without appealing, they went without care, or they paid out of pocket for a claim the company already knew it should have approved. The American Medical Association published a separate analysis showing that insurance companies collectively spend an average of 11 seconds reviewing each prior authorization request before making a decision. 11 seconds to evaluate your surgeon's recommendation. 11 seconds before the denial letter is generated. And according to the Kaiser Family Foundation, only about 1% of patients who receive a denial actually appeal it. 1%. That means 99 out of every 100 people who get a denial accept it. Some pay out of pocket. Some delay their treatment. Some do not get treated at all. UnitedHealth Group is counting on every single one of those 99. So what does this mean for you? If you are covered by UnitedHealthcare or Aetna or Cigna or any Medicare Advantage plan, here is what you need to know before you ever accept a denial again. Number 1, you have the right to an internal appeal. Under the Affordable Care Act, every insurance plan must allow you to appeal any denial. You must file within 180 days of the denial. The insurance company is required by federal law to give you a written decision within 60 days. Number 2, you have the right to an independent external review. This is the federal law I mentioned at the beginning of this video. If your internal appeal fails, or if your insurance company misses its response deadline, you can request a review by an independent third party, not the insurance company, not someone they hired, an independent reviewer. According to the Kaiser Family Foundation, approximately 40% of external reviews result in the denial being overturned. 40%. Number 3, here is the phrase I promised you. 4 words. When you call your insurance company after a denial, say these words exactly. I am requesting reconsideration. Not I want to appeal, not I think you made a mistake. I am requesting reconsideration. In most insurance systems, that phrase triggers a formal, documented process with required timelines. It creates a paper trail. It signals that you know your rights. Representatives are trained to handle complaints. They are not always trained to handle formal reconsideration requests. Those are two very different conversations. Number 4, file a complaint with your state insurance commissioner. Every state has a regulatory office for insurance companies. A formal complaint costs you nothing. It creates a regulatory record. Insurance companies track complaint ratios by state. A pattern of complaints triggers an investigation. Use it. If what I covered in this video surprised you, the monopoly structure, the algorithm, the 11-second review, there is something else you need to know. The out-of-pocket maximum listed on your benefits card. Most people believe that number is a ceiling, that once you reach it, the insurance company covers the rest. It is not a ceiling. In the next video, I am covering exactly what insurance companies are allowed to do after you hit your out-of-pocket maximum, and what employers are not required to disclose when they hand you the benefits packet on your first day. If you have a family on your plan, this one matters. If this is the kind of information you want, what the brochure does not say, what HR does not explain, what federal law actually requires your insurance company to do, subscribe. Every week, I cover a different law, policy, or practice. Your insurance company is counting on you not knowing. UnitedHealth Group made more money last year than the GDP of most countries. They made it by collecting your premiums, by owning your doctor, by managing your prescriptions, and by building an algorithm that makes denial decisions in 11 seconds. That system is not broken. It is working exactly the way they designed it. But the federal appeal process was also designed to protect you. It exists